Frances Dare with Cisco's Global Healthcare Practice, and we're here in Cisco's booth at HIMSS, where we're in particular featuring our new HealthPresence solution, which delivers new ways of providing healthcare to patients and their families with different members of their care teams. It could be a primary care physician or a GP with a specialist physician and a patient and their family, possibly in 3 different locations, but meeting simultaneously, and with a truly immersive experience that feels very much like an in-person experience, and with the ability to use medical devices to examine an ear or to hear a heartbeat and have both the physician see that, but also the patient see that on the screen as well. And we can also integrate then with tools like electronic health records. So in essence, we integrate all the dimensions of a care experience, the people-to-people connections, the data and information that's needed, as well as the diagnostic devices in a very innovative new way to deliver health services.
Fantastic. And what kind of technology would a patient need in their home setting to be able to do this?
So we envision the day where this will be available at home. In this release of the technologies, we would see these 2 different or 3 different endpoints being in places like hospitals, medical clinics, could be at corporate work sites, could be in a retail setting like a shopping mall.
Right.
The possibilities are endless.
So even in an urgent care center, as we've seen that emerging in the Walmarts of the world and so forth.
Great example, Nick. That's exactly right.
Right. And what kind of technology can you implement in terms of communication over and above the video? So what is the technology that you have on the desk there that's allowing the physician to interact with the patient remotely and derive some clinical information?
So you can see here that we have a variety of medical devices. We do have a camera that can be used to examine the skin, freckles, or skin lesions. We have an otoscope so that we can look in a patient's ear and do diagnostic procedures that way. We have the tried and true thermometer, but in this case it's digital, so it transmits the information as well. And we can also incorporate things like the digital stethoscope, digital scale for weight, and with all of the new developments around biomedical technologies, we envision being able to integrate even more diagnostic devices as those are developed.
Okay, and in the case of the digital stethoscope, is then any additional analysis done to the sound waves, or is it purely a transmission of that information to the physician? So are we supporting them with additional knowledge, or is this really just trying to bring the physician closer to the patient?
It brings the physician closer to the patient, but the other dimension as well is that for the first time, I as a patient can hear that heartbeat at the same time. And so in the past, where the physician might look in my ear and describe it, but I don't know what the physician sees, or they might hear my heartbeat, but I don't know what that sounds like. It creates a very personalized care encounter where the patient's more involved and more engaged.
And I think moving the patient much more towards being their own personal management of their own health care. If you involve them in this way, I think they're going to be much more comfortable and start to understand, so we're educating as well.
That's exactly right, Nick.
That's great. Really appreciate your time. Thank you.
Nice to talk with you today.
Thanks.